gentleman and he didn't ever complain. Last Monday, the 31st, my dad sadly lost his fight.
Gisella's father is one of the numbers we keep hearing about, announced from a podium. Last week, 95-year-old Giuseppe died of COVID-19. Because he was in a care home, he did so practically alone, without his family.
So to not be there in those crucial last hours, holding his hand and letting him pass on, it's safe in the knowledge that his family were all around him that loved him terribly. I know my father was 95 and he lived to a grand old age, but this was not the way he should have been taken from us. This is not what we wanted. It's not what we want for anybody else. It's been truly heartbreaking. We must not forget about all these elderly people that are in care homes and nursing homes across this country. All of those, some of them, many of them are not as old as my father. This testing must come out so that they can be looked after to the very, very end. And people like me, maybe if I had been tested and I was okay, I could have gone in there and held his hand.
In one sense, Giuseppe wasn't alone. Thousands of our elderly fathers and mothers are in care homes, confined to their rooms in the shadow of this virus. In Hove alone, 3 nursing homes have reported cases, and once it's in, it spreads like wildfire. In Giuseppe's, 16 of 20 residents now have the disease, and all the time, homes are fighting on other fronts, reporting a lack of equipment and staff. The local MP wants the problem recognised urgently.
How does coronavirus get into a care home? Families haven't been able to visit care homes for a long time now, so it is only getting in by staff. We have agency staff that is working in 2, 3, 4, maybe more care homes in the course of a week. So it's the staff themselves that are bringing it in. We need to start testing staff.
And worryingly, Kyle thinks that care homes are now being asked to manage this crisis in a way for which none of their staff were prepared.
It's very clear that the people who are directing health locally and regionally are encouraging people who are running care homes to get their residents to sign do not resuscitate orders. This happens in the course of life anyway in a care home, but it's happening en masse. They're asking basically as many residents as possible to sign these things. Now what this means is that they are preparing care homes to deal with palliative end-of-life care within the care home. These aren't hospices, these are care homes. It also is a very strong indicator that they're not going to send people to hospital when they get ill.
They probably will say that I bark at them all the time because I'm constantly telling them to wash their hands every 30 minutes.
There's no COVID-19 at the Grange Rest Home. Sandra and Lorraine, who manage it, have been told by local medical authorities that should it come, it's unlikely their residents will be taken to hospital.
So they might be in their 70s and 80s with medical conditions, but I don't see their age. I see them as people. So I've got that attachment. So when I'm being told that there's a big possibility they won't go into hospital, I can't understand why they can't receive the same care that I would like to expect. Well, obviously, that do not resuscitate has been replaced by a respect form, but I still think that that respect form, the way it's been rolled out, is in conjunction with COVID-19.
In what way?
Because obviously with this kind of policy around elder people and maybe not being admitted to hospital, it links in with that.
Because we're not carers, we're not nurses, we will be potentially treating somebody with a deadly disease that if you listen to, some people that get it, they're struggling for breath, fighting to breathe. We have no experience in dealing with that.
I mean, how do you think, just generally speaking, that old people are being treated and thought of in this crisis?
I think, myself personally, I think it's disgusting. Yeah. I feel that they're sort of lambs to the slaughter, to be honest with you.
It's clear, talking to those who provide care in this city, that social care is in effect being asked to become part of the NHS, to do things that normally only the state would do, but without the resources and scale that only the state can provide. It poses a unique challenge for a sector which was already in a perilous state. Time and again, we've heard that this is a disease of the old and infirm. Insofar as that is true, such sentiment blithely ignores the toll on those who love them, who care for them, in both senses of the word. In these most testing of times, that toll is great indeed.